It's a pleasure and a privilege for me to be able to be part of this programme, and I'm very grateful to everyone who's taken part, but particularly, of course, to Sarah and to Manan, and also as Deputy Head of the School of Clinical Medicine to be able to sign the Promise Charter on behalf of the University of Cambridge. I'm chairing this session, and as many of you will know, I'm a psychiatrist, and this is a session about learning together. And I was asked to speak about the future of psychiatry. And we've all only got 10 minutes to think about the next generation of psychiatry. And recently, a few months ago, my house was badly flooded. And when something like that happens, it can be a seminal moment in one's life. My wife and I have been clearing out lots of junk that we've accumulated over the past couple of decades. So it's been a time when I've been thinking a lot about the past. And of course, the only thing we have to guide us about the future is the past. And for next generation psychiatry, I was thinking about the beginning of my generation of psychiatry. And the first time that I went to see a mental health patient was with a consultant psychiatrist that I was attached to as a medical student in the early 80s. And we drove down from inner London to a hospital called Banstead in Surrey, which was one of the old asylums in a ring around London. And it was on the way to be closing, and I went to visit some people on one of the wards, used to be called a back ward of a hospital like that, and it was full of middle-aged men with long beards sitting in chairs around the edge of the room, some of them completely silent, others talking to themselves. And that was my introduction to, or part of my introduction to psychiatry, and actually I found that completely fascinating, and other parts of my medical student journey brought me into psychiatry. And then in my first psychiatry training job, I was at the Bethlem Royal Hospital down in Kent, part of the joint hospitals of the Maudsley and the Bethlem. And one of the things that I found in my clear out at home after the flood was this key. You see, it's a bright key, gunmetal. It's got GM 109 on it, Grandmaster 109. And this was a key that was issued to you as a registrar, we used to be called, the trainees in those days. And it was, of course, to unlock the doors of the wards. And it reminded me of one of the things that the trainee psychiatrists used to vie about as we got different jobs on the rotation, was all about the charge nurses on the ward, because some of the charge nurses liked to keep their wards shut, locked. And other charge nurses would only lock the doors if there was a difficult situation, and other charge nurses would keep the doors open. And there was a kind of paradoxical effect in some of the trainees, because they would prefer to work on a ward where the door was kept locked, because the number of clinical decisions was kept to a minimum about people leaving the ward. And it was during that time at the hospital that regime completely changed. And that was changed by the patients and some of the staff who felt that this was unacceptable in the late 1980s. And so policy was changed. And if you like, a generation of culture and thought about the way acute wards should be run was altered. And it was altered from within. And there was a shift of power on all sorts of levels, not just from the charge nurses, but also from the other staff and the patients on the ward. And the wards became unlocked all the time. So I think that told me something about what the next generation is. Each time, my first exposure to a hospital was with men in a back ward with chronic mental illness where little was being done. And then things seemed to modernise, but looking back, it seems terribly old-fashioned that I still have this key, which incidentally, of course, I'm sure I should have given back. But it's a nice memento of those days. So the point of this is twofold. That one, we all have the next generation in our own hands. It's up to us to form that. And that's what this Promise Charter is all about, actually, the process of forming that. And the other is that whatever we think of as good practice now or tomorrow, it's going to be changed in a month, a year, in a decade, but it's still up to us to define that. So those are my sort of very personal reflections of the next generation, that it is in our hands. And I'm going to pass on very quickly now, because the next two sessions really are about defining that future. So it's a pleasure to hand on to Melanie Bird and Julie Tetheridge, who are going to think about New Age nursing prospectors. And while you're listening to all these talks, I want you to remember the section in your packs where you've got some points for reflection. And this is the marker for this session now. Do, as we go along, put your thoughts down and remember to hand in these sheets at the reception at the end of the session. So it's a pleasure to hand over to Melanie and Julie from Anglia Ruskin University.